This is the Star News Brief. I'm Tina Mambono. The port of Mombasa could be under the control of Chinese if the government defaults on the 364 billion shillings SRJ loan. The Auditor General reveals that the assets of Kenya Ports Authority were used as collateral for the 363.96 billion shillings standard gauge railway loan. In a report tabled in Parliament, the Auditor General reveals officially for the first time that Kenya waived its immunity in the event of a legal dispute linked to a default of servicing the loan. The borrowers, KPA and Kenya Railways Corporation, gave up a claim to any immunity from legal proceedings or any of their assets. This would be in respect of any cases filed today or in future in connection with the agreement. Get a copy of The Star by subscribing to our e-paper for only 10 shillings by dialing *550*3#. Former Prime Minister Raila Odinga will keep off public engagements as he recovers fully from the coronavirus. The ODM leader, who was on Sunday discharged from Nairobi Hospital, where he spent 6 days after testing positive for COVID-19, will be under home-based care at his current home. Sources told The Star the opposition chief will be out of the limelight for at least 1 month in line with doctors' advice. Doctors recommend that Raila takes a long rest before embarking on his engaging political activities. Only family and close aides will access the opposition supremo, according to our source. During the isolation period, he will undergo further tests to confirm that he is fully recovered from the disease. On Sunday, the ODM boss also alluded to his anticipated long leave from public space, saying he will religiously follow the doctor's advice, including self-isolation. Appropriator was moved to tears after a parliamentary committee probing the 7.8 billion shillings KEMSA scandal said her late husband followed the law in the procurement of COVID-19 supplies. Omaira Pharmaceuticals supplied 10,000 infrared thermometers at 5,000 shillings each, netting 50 million shillings. Dorcas Njoroge, director at the firm incorporated in 1998, got overwhelmed and could not hold back her emotions after the Public Investments Committee gave her a clean bill of health. This followed the revelations that it was KEMSA that wrote to her husband, who died from a heart attack last July, inviting them to bid for the tender. The firm is pre-qualified by KEMSA as the supplier of equipment and still trades with the Medical Supplies Authority. Public transport vehicle operators have demanded they be allowed to carry full capacity and the revocation of an order requiring monthly fumigation certificates. This was when the President delivered the 14th address on the coronavirus pandemic at State House, Nairobi. Matatu Owners Association Chairman Simon Kimutai, Association of Bus Operators of Kenya Chairman Edwin Smukabana made the appeal on Sunday. They said earnings have dwindled since social distancing measures were imposed last year to curb the spread of COVID-19. The COVID-19 protocols require PSVs to carry not more than 60% of their capacities. Omar Lali, the Playboy boyfriend of Keroche Brewery's heiress Tekra Muigai, did not report to Jaha House management of any emergency on the day of her alleged fall, the hotel's housekeeper told the police. Geoffrey Maliolo, a room steward who was in charge of the suite that Omar and Tekra checked into, told the police that despite clear instructions, complete with contacts for customers to inform management of an emergency, Omar did not do so. He did not call for help after Tekra allegedly slipped and fell from the stairs, he added. Maliolo told detectives that the rooms the two occupied had emergency instructions for customers clearly displayed, requiring that the management be notified of any incident, but Omar did not comply. And civil society organizations have written to the Health CS Mutahi Kagwe demanding that he sheds light on the rationing of antiretrovirals to persons living with HIV in the face of COVID-19. It has now emerged that many people living with HIV are given less than the expected dosages in small polythene papers when they go for their refills. This has resulted in panic, fear and anxiety, as any change in the dosage and packaging of ARVs ought to have been discussed with the relevant stakeholders. On the contrary, there was no discussion or notification. People living with HIV just encountered the change while at a facility to collect their refills. The initial commitment by the government was that patients get refills of ARVs enough to last them up to 3 or 4 months, but the recent turn of events has seen them get drugs enough to last for just 1 month, while some get just for 2 weeks. Get a copy of The Star by subscribing to our e-paper for only 10 shillings by dialing *550*3#. You can also get more on the Star website.